Temporomandibular joint dysfunction, TMD, can be tricky because it can present in different ways and has different underlying causes. That being said, true weakness on one side of the face, especially without pain, cannot be attributed to TMD. If you have acute weakness on one side of your body, please call 911. Weakness on one side of the face is best evaluated by a neurologist, or at least please seek medical care. One of the aspects we consider is whether the weakness affects only the lower part of the face or the whole half of the face, including the eye and the eyebrows. If only the lower part of the face is affected, it tells us that the problem most likely comes from the brain itself. If the weakness involves one side of the face, like the whole one side of the face, then it's more likely what we call a peripheral issue. The issue is more peripheral on the pathway from the brain to all the way to the facial muscles. So one of the most common cause, or most well-known cause of peripheral facial weakness is Bell's palsy. The facial nerve is responsible for the movement of the muscles of the face. It has a lot of different other functions too, but it also helps close the eye. So if there's a facial nerve issue, there may be difficulty with closing the eye. And if there's incomplete eye closure, eye protection and lubrication are key, including closing the eye at night with a permeable tape to protect the cornea. The easiest way to detect facial weakness on one side is droop at the corner of the mouth or flattening on one side of the nasolabial fold.